to another episode of Questions with Crocker with me, Dr. Crocker. And I have a guest today. I'm so excited to introduce Dr. Alex Sigmund. And you are a veterinary ophthalmologist, correct?
That is correct. Yes.
So you deal with eyes all day long. You love eyes, which I will say, God bless you, because people like me who know not what to do after the initial issue are so happy we can send patients to you and you can work them up more thoroughly and provide more in-depth care for our pet patients. So tell me a little bit about how you became a veterinary ophthalmologist and also what type of animals you actually see and work on.
Yeah, good questions. The most straightforward answer is after you finish vet school, I did a rotating internship at the University of Tennessee. I then did a specialty ophthalmology internship for a year down with Blue Pearl in Tampa. And then I went back to the University of Tennessee for a 3-year residency. So that was 5 years after graduating vet school, and then went out into practice after that. So it's kind of a long road, but it's been worth it.
It's a very long road. And I tell students all the time, who are telling me like, I think I want to be this specialist. I think I want to be that. I'm like, that better be 110% the only thing you want to do because you spend so much time getting to that point. And so you want to make sure like the only thing that you ever want to do for the rest of your career is that, because I can't imagine spending 9 years doing that, 10 years, and then deciding to go a different direction.
Yep.
And this is a podcast based off of questions, and we had a lot sent in, but a lot of people wanted to know like how you set yourself up for success. How competitive is it to become an ophthalmologist? So I'll let you finish your story, but if you can touch on that, that'd be great.
Yeah, absolutely. So your second question was like, what kind of animals do I usually see? And definitely it depends on your practice. So my practice is really only set up to see cats and dogs. In residency, we get to see pretty much any type of animal that comes into the hospital. So I was looking at sloths and eagles and tigers and all kinds of things, which was really cool. It's one of my favorite things about this job is that I do have the ability to look at other animal species. In private practice or in corporate practice that I'm in now, I do have some relationships with our local zoo and aquarium. So I've been able to at least get some of my exotics in, looking at them if they need that. So you kind of can tailor a little bit. And then there are ophthalmologists who only do equine. So you really can kind of tailor it to what you like to do.
I did equine initially.
Right.
And I will tell you, there's a few equine issues. And then the rest of the time we're like, we'll just take the eye out. It was I think it was a little more minimal than probably what you do, at a higher level with small animals. So I think it's nice to know the degrees of care, I guess, we can offer our pet patients. I know that ophthalmologists do cataract surgeries. You post a lot of amazing cases on your social media. You guys should definitely follow him on Instagram. Tell him what your handle is.
It is the Vet Eye Guy.
That makes
Instagram.
sense. The Vet Eye Guy.
Yep, that's me.
Very catchy.
I thought so, but then as far as kind of competitiveness for ophthalmology and kind of how I prepared myself, I was kind of a little late to the game, I'll be honest, where I didn't know that I wanted to be an ophthalmologist until my 4th year of vet school when I was rotating through the ophthalmology service and I got to see cataract surgery. And I thought that was the coolest thing that I'd ever seen. And I knew I had to do that. And I had to do whatever it took to do that. And then I kind of quickly learned that it is very competitive to get an ophthalmology residency. I think the first year that I applied, because I did not get it my first year, but the first year I applied, excuse me, I think there were 9 slots available, and there were over 60 to 70 applicants that year. So you really have to be dedicated to trying again. And so luckily I did, and I got it a second time. A lot of preparing yourself for residency or to get a residency is the relationships that you form. So you need to know an ophthalmologist. An ophthalmologist needs to know you well so they can advocate for you. Because kind of unfortunately, if the ophthalmology world doesn't know who you are, you're not going to get a residency because a lot of it is relationship based. But otherwise, of course, research is always helpful, especially in the ophthalmology field. If you're a rotating intern, definitely make a relationship with your ophthalmologist that should be there, because if you want to do ophthalmology, you need a rotating internship with an ophthalmologist, and trying to get into some retrospective study that you can finish within that 1 year. So there's a lot you can do, but some of it is just based off of relationships.
I think that that in general is important in our career. I tell people all the time that I really feel like, just even as a general practitioner, ER doctor, I can teach you a lot of the medicine. I can teach you surgery. I can't teach you how to talk to people. I can't teach you how to be a good person, how to be a team player. So if I'm looking to hire, I'm actually looking more for like, who are you? What do people say about you? What do people think about you? And not like, are you the smartest person in the room? Because all of us got into vet school.
Mm-hmm.
All of us are very capable and are intelligent, right? And so I like that, I think the networking is a huge component of opening doors in this profession in general. But that's a whole nother podcast.
It is. I'm happy to talk about that at a later one.
Yeah, we won't go down that. But okay, so the way that this podcast is structured, it's called Questions with Crocker because basically people send me questions and we answer them. Usually it's with my husband, but I have you today. And so we have all eye questions.
Perfect.
So excited. And I got them from veterinary professionals, vet students, and also pet owners. So a huge degree. And just to let everyone know, he is not prepped on the questions. He does not know what they are.
Nope.
I just wanted to come into this like supernatural and just hear what you had to say and, hopefully educate people a little bit more on like what you do as an ophthalmologist, but also help us as veterinarians do better for our pet patients and their eyes. So we're going to get started. So the first question, and this one's pretty simple, but at Shay Poindexter wanted to know, can dogs get pink eye?
So it's interesting that, short answer is no, because pink eye.
He did air quotes. Yeah. That was air quotes that he did. If you're not watching YouTube, there was air quotes from the no.
You should tune into YouTube for entertaining facial expression. So pink eye in human medicine is a bacterial conjunctivitis, and dogs and cats rarely get bacterial conjunctivitis. Conjunctivitis in cats is primarily viral, and conjunctivitis in dogs is usually secondary to something else like dry eye, glaucoma. Allergies is a very common one these days, especially down here in the South, because I'm down here in Georgia. But as far as a true pink eye that's bacterial, that's uncommon.
Okay. So just for me and my knowledge, if a pet comes in showing signs of conjunctivitis, which is kind of the tissues around the eye being really inflamed, maybe having like drainage, discharge, I'm going to probably work them up for other causes before I just assume that it's a bacterial issue. Mm-hmm. And that kind of leads me into the next question, which I actually had several people ask this question in different ways. So we will go with just one of them. Basically, they wanted to know, at Shelby Stevens wanted to know, what is the recommended treatment for adult and senior cats with chronic ocular discharge? And a lot of people wanted to know, what do I do about my cats having chronic eye issues? So let's speak to that a little bit. I think it kind of goes back to you saying conjunctivitis is more viral in cats, but let's expand on that a little bit more.
Sure. So definitely when I get an older patient that's coming in with tearing conjunctivitis, swollen eyes, squinting, the first thing I think about is conjunctivitis from herpes virus. Herpes virus is just over 93% of the world's cats have herpes virus, whether they show signs of it or not. Our testing for herpes virus is not that accurate. So if you get a negative on one of those upper respiratory panels, that doesn't mean they don't have herpes virus. It just means they're maybe not shedding virus at that moment. So I rarely test cats because I can't really trust a negative, and that's kind of the whole reason that we would need it. And a positive could be positive in any cat. They may be subclinically shedding at that time. So it's hard to know what exactly the cause is. So I just don't want to spend $300 and something on an upper respiratory panel. I don't have to.
Yes. Word to that.
So if they don't have an ulcer, I don't see any corneal like infiltrates that could indicate some autoimmune diseases. If I see keratitis at all, it's pretty much herpes virus until proven otherwise. So that's corneal blood vessels. If it is just conjunctivitis, then technically herpes virus is like my top 3, but then the next 2 are chlamydia and mycoplasma. So
your top 3. Yeah. I love that.
So it is kind of a trial and error where if they have, so chlamydia typically is going to cause raging conjunctivitis, like huge swollen conjunctivitis. that probably has a chlamydia component to it, and you need something like terramycin and doxycycline. But for just kind of a mild conjunctivitis, definitely really look for those blood vessels in the cornea, because that is going to be a hallmark for herpes virus, where you need an antiviral like oral famciclovir or a topical compounded antiviral like cidofovir, idoxuridine.
So you're saying an antiviral eye drop?
Yes.
Okay. Interesting. Interesting. I don't know that I've really used one that much in cats. So number one, it's not a curable thing, correct?
Correct.
Like they're always going to have herpes virus. I think that's always important to set the expectation with pet owners. Like, we can help these flare ups essentially, but we're probably not going to get rid of this. And then the other thing would be, I think a lot of us have lysine in our practices, and we talk about using that with herpes. So I don't know if this is like a controversial ophthalmology.
It is.
Oh, okay. I like a little controversy.
Yeah.
Tell me about lysine in herpes cats. What are your thoughts and feelings on that?
So there are a lot of varying opinions. Well, I guess there's three varying opinions. One, people think that it works, people who think that it doesn't, and then people who are like, well, it's not going to hurt, so you might as well try it.
Right.
Right. I would say our most recent literature, where they've done like in vitro studies of herpes virus in combination with lysine concentrations, have found that lysine does not inhibit herpes virus replication, which is the whole goal. Because I don't know if we want to get all into this, but herpes virus.
Keep it simple. Okay. Keep it simple.
Basically, so lysine interferes with herpes virus replication, supposedly. And there are some people who swear by it. But there are studies that don't really support that. And there are some studies that show it actually worsens disease because of the stress of giving a cat, especially oral medications. But if you have a cat that loves these little treats, it's not going to hurt them to be on it at all. And you do have some people who just swear by it, even ophthalmologists. So if an animal comes in and they're on it and they're doing fine on it, sure, I don't really care. But I do not start any of them on it, personally.
Okay. I think that's fair. I like the neutral stance there at the end. I will say, so lysine is like a treat. And my tip and trick for people in general practice is don't try to give it to the cat in the mouth. Cats don't like things on them. So I have owners actually dab it on like the cat's foot. And the cat will lick it off because they don't want things on their fur. So they'll clean themselves and they'll take it in. So it's just a small dab of like a flavored, I don't know, paste sort of.
Okay.
But if you do that or you put it on their nose, they'll lick it off. And then you're not trying to like shove it in their mouth.
Yeah.
So
perfect.
That's my GP treat.
Love it.
Yeah. Trick. Okay. So that is definitely helpful. In general, a lot of people had questions about ophthalmic exams, and I'm just going to like out myself right now. I know how to do kind of a direct exam, but when you start getting into fancy other things that shift and move and lights change and I get lost. I feel like I'm looking for what I need to look for. Because of working on horses, I do feel like I can look at the back of the eye pretty good. I can see if there's any darkness changes. I can look at the cornea pretty well. But for us general practitioners, or even in the ER when things present, what are kind of your basic things that we should always do that you would expect us to kind of be thorough with? And are there any tricks to doing a better ophthalmic exam?
Good question.
It's a lot. I know. It's a lot.
I feel like it's never wrong to do a Schirmer's, stain, and IOP on these patients that come in with a red eye. Because a red eye can literally be any of those three things. If you can rule out those, like you can rule out dry eye, rule out an ulcer, and rule out glaucoma, you've kind of ruled out the really scary things that can go bad very quickly. So then otherwise, the red eye is like, okay, hopefully this is something that we can kind of figure our way through without it being necessarily like an emergency. They're going to lose vision in 24 hours because we didn't diagnose glaucoma, something like that. Mm-hmm. For me, the ophthalmic exam, I have an order to it just to kind of help me, just like a regular physical. So I just start from the outside in and just kind of work my way from how are they navigating to, PLRs and what does the lids look like, conjunctiva, cornea, iris, lens, vitreous, and then the retina. And I do that every single time on every patient. So I can at least know that I've evaluated everything. Kind of tricks for Well, I mean, in general practice, you just don't have the type of magnification and the type of light source that I have that allows me to see these really subtle differences. So I definitely don't expect vets to be like, there's a posterior subcortical incipient cataract, blah, 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 because there's just no way for you to know that. And that's why you're just like, I think it has a cataract, period, you know? So if I'm trying to assess for a cataract, it's really kind of how well can I see the tapetal reflection that's coming back at me to kind of gauge the density of that cataract. Is it immature because I can still see nice of tapetal reflection? Is it mature because I can't see any tapetal reflection? So it's kind of my main way to look at broadly a cataract. For the
my standard is more, are they blind or are they not blind?
Sure,
That's
yeah.
my standard. Like, can they still see or can they not see? That's the degree of cataracts that I
yeah, and
judge.
cataract discussion, a whole other thing, but that's kind of my main question to them as well, as far as trying to decide if we're doing surgery or not, is are they navigating well or are they not?
Okay.
So, but that's a different.
You put it a little
topic.
more technical than me, which is great. That's great.
But as far as something kind of objective to try, well, it's objective too if they can see or not. But another way.
What about, you mentioned intraocular pressure, IOP,
Mhm.
and that requires a Tono-Pen. So I will tell you, I bought my practice a year and a half ago, and they didn't have a Tono-Pen. And I'm like, we need this. Like, this is, important. And I'm like, I'll just get one at the next conference. I'll, grab one. Those things are expensive.
They are. And I've gotten that question too.
I was thinking like, a couple $100, maybe $1,000. I mean, they're thousands of dollars. And if you really want the good ones that don't make you crazy while you're trying to actually get, a pressure on a patient that's awake and moving and doesn't want you to mess with them, it's really expensive. So one, do you have a Tono-Pen recommendation that's reasonable? And two, if you don't have a Tono-Pen, we had a question about how would you still check or could you still check intraocular pressure in any way? At Leah Tannenham wanted to know, is there a cheaper tool that we can use? So I thought that was an interesting question.
I guess the short answer to a cheaper option is probably not. So before we had the type of tonometers we have now, people would use digital assessment where they would literally push on the eyes to see if they are hard or not. That kind of gives you a rough idea, I would say, but it doesn't give you a number. And the number is actually the important part because that's what research goes off of to tell you, what type of drops do they need? Do they need more aggressive therapy? Do they need an aqueocentesis where we drain some fluid? Like, is this a true emergency type of thing? I feel like I like the Tono Vet, the Tono Vet, and then the Tono Vet Plus. So those are two rebound tonometers that actually shoot a little probe out to bounce off of the cornea versus directly touching the cornea with a Tono-Pen. The risk of ulceration is less, and you don't have to use proparacaine to numb the eye. So I do like that one more. I think I found some used ones online for about $2,500. But they definitely can be expensive. But it's also a tool that can potentially save the sight of one of your patients, because I do get a lot of referrals to me for a red eye that's been treated with steroids without a pressure assessment. And it's been 2 weeks before they could come see me. And that eye is completely blind because it ended up having glaucoma. And owners can be a little upset because they always ask me, is there anything we could have done to save this eye? And I was like, well, in the long run, no, because glaucoma will pretty much always cause blindness with time. But we could at least delay the onset of vision loss if we can catch it early. And that's where owners, I think, will pay for it. If you could say, hey, your dog is maybe a predisposed breed and it has eye redness and corneal edema and mydriasis, we need to check a pressure because I'm afraid it's glaucoma. So, and then they're usually like, well, if this could save my dog's vision, then let's do it. So it's kind of how you sell it to them too.
I like that. That's a helpful communication tip. And then also I wrote down the Tono Vet Plus because I need another Tono-Pen. And so I appreciate that information. And I do agree it is important. Now, in the ER, we see dogs and usually they have worse things, I would say. Like, we don't see them for that like initial kind of redness issue, or it's like the eyes like
Huge.
bulging out of the head, right?
Not an emergency at that
So
point.
yeah, it's like, but there's a couple things you touched on that I want to ask additional questions about. One, you said you kind of see dogs and maybe they could have been referred earlier or the diagnosis could have been found earlier. And I actually had quite a few people ask, when should we refer things kind of directly to you? Um, are there certain things that if we see it, we should just say, you just need to go to ophthalmology now versus let's try A, B, and C? And obviously it's very dependent on, like everything in vet med, financial constraints from owners, expectations. But I do think it is important for us to know like what eye emergencies are true emergencies and need to come to you quickly. And then what is maybe able to wait. And one of those I want to ask about is like a perforation of the cornea, like a ruptured eyeball. So why don't you get into that a little bit for me? And let's see if we can help answer that question.
Okay, perfect. So as far as like a true emergency, I think some of it depends on your comfort level with eyes and monitoring and making decisions that you feel confident about. So if you have an infected ulcer and you're convinced that it is infected, there's stromal loss, infiltrates, you are not comfortable with eyes, you should probably refer that more emergently so that it can be monitored by someone like me who is comfortable with that. If you are comfortable with that, then you can manage that yourself. And maybe if it starts not responding to medication, that's when you refer it. If you have something like a desmetaseal, used to be that desmetaseals were treated emergently. I tend to not do that. I keep the animal calm and then hopefully get them in to see an ophthalmologist soon after, as long as it is the infection that caused that desmetaseal is under control. So again, it goes back to the infection. If you still think it's actively infected, then it should probably be referred.
Just for people listening who aren't vet professionals, desmetaseal would be what in layman's terms?
It's the deepest ulcer you can have without the eye rupturing.
And I see those a lot in the ER. And just an offshoot, would you do topical and oral antibiotics in those?
I only treat corneal issues with topical therapy because that's going to be your highest concentration is achieved directly onto the eye.
Okay. What about pain control? Do you do oral NSAIDs? Because I've had some ophthalmologists say, and people honestly that have had ulcers say it's very painful. So what would be the if I'm seeing it in the ER, it's a basic ulcer, right? Like the groomer caught it. We're going to start treatment. What pain control would you recommend on those guys?
So unfortunately, our literature doesn't show that NSAIDs really do much for corneal pain. No studies have been done with something like gabapentin to know about corneal sensation, but I will use gabapentin just because technically it theoretically should work because it's a nerve pain reliever and we're dealing with corneal nerves that are painful. So I will opt for something like gabapentin because it also helps them stay sedated to help ease, recovery and stuff like that. But my biggest, when owners ask about pain control, I will try to deal with secondary uveitis, like if they have reflex uveitis with meiosis with an ulcer, put them on some atropine because that'll help with that muscle spasm. And then otherwise gabapentin, but I usually don't opt for NSAIDs.
Okay. Interesting. Mm-hmm. I like that. And it's funny what a variety, like you said, like specialists have with different things they do and what they use. So for people listening, if you've been to, a veterinary ophthalmologist or you're a vet and they've done A, B, or C, and it's not exactly what we're saying, that's okay.
Correct.
It's everything based off experience and, what you feel works and what you've studied and learned. And so there's really not, and with eyes especially, I would say, there's not always an 100% way to do things.
Correct.
Because I like to go bad quickly. Eyes are really tough to treat, which is why, people like you are so important. So with the one that I brought up where they come in and it's actually a ruptured ulcer or trauma and, the eyeball has ruptured, is that an emergency? Because I will say not everyone can either afford like the emergency enucleation right away, or they want to try to save the eye if, it still is round, I guess. So how emergent is that once you already have a hole in the eyeball? And I know that sounds very grotesque in a way.
Not for me.
Yeah. You're like, I love it. Send it to me. No. So what would be my degree of, I guess, like concern and recommendations for the owner time-wise on those?
Sure. I think it depends on, so if you have a trauma that's caused a rupture, it depends on the degree of trauma. So if you just have like a penetrating injury, then that may be less of an issue than if you have like, I crushed my eye and that's how it's like deflated or something, but that may be extreme. So a routine kind of perforation, the biggest question I always have is the eye visual or not? So does it have and sometimes that's hard to know because they're really squinty, but we can at least try and get their eye open, shine the brightest light you possibly can find in that eye and see if they dazzle and see if they have a PLR in that eye. If you can't see a PLR, always assess the consensual PLR in the other eye. Because if they don't have a PLR in their other eye, the chances of a retinal detachment are very high in that perforated eye, and then it may not be worth expensive surgery to fix the cornea. If there's a ton of blood associated with this rupture, that is also not a great prognostic indicator. If there's a lot of tissue coming out of the eye, like iris tissue, that's also not super great. But I have seen some of not ideal.
Not ideal.
But I'll always assess for that consensual PLR. So if it's a reasonably sized perforation that is sealed, which means the eye is decompressed, the eye has plugged itself up with fibrin, then those eyes maybe can wait to see someone as long as that eye is relatively stable. They go on oral antibiotics, minimal topical therapy, because we don't want to stress this animal out by opening their eye all the time. So if it's perforated, 3 to 4 times a day for your topical med, and then your twice a day oral antibiotic, and then pain medication like an NSAID and stuff, because those are painful on the inside of the eye, and then kind of send them in. I will usually wait on a perforation as long as it is sealed. If the owners don't want to go forward with surgery, especially on an emergency basis, it gets very expensive. So we'll give it like a week to see if it's getting any better. And if it's not, then we can still opt for surgery, or we can continue with medical therapy if it's improving. Because the eye has ways to heal itself.
Yeah. And I've seen that, and it's been crazy to me, and probably more with like rescues where they're kind of like, we probably need to do surgery on this, but financially, and we'll do all the orals, we'll put a cone on it, and we'll see what happens. And a lot of those eyes will heal, especially cats. Like cats are crazy good healers.
It's not to do a sidebar, but I had this crazy case that this cat had like run outside, come back, and literally half of its iris was on its cheek. And it was supposed to come and see me. And the owner, I had gotten all these pictures. The owner couldn't find the cat, or it had like hidden and it couldn't come in for surgery. So we were like, if you can't find the cat and you can't treat the cat, you probably shouldn't do surgery, just remove the eye. But she sent me a picture 3 days later, and it had already started to pull the iris back into the eye. And then like a week later, it was completely healed and the eye was visual. And I was like, cats are amazing. They do amazing things. Even if I would always give a cat eye a chance.
Yes. Cats are incredible. The joke is like, if their leg falls off, just set it next to them and it'll like reattach itself, which is a very emergency joke, but they really are incredible healers. And I agree. I'll have these young kittens that get really bad ulcers and severe, and we'll treat them and we'll give them time. And like those eyes will definitely heal over time. So cats and dogs are definitely very different, which makes our jobs interesting in general. So you touched on enucleation or surgery just a little bit. I will tell you, enucleations are one of my favorite surgeries to do.
Me too, which is probably not good for me as an ophthalmologist.
You're saving the eyes. I take them out. But I do think there's a couple good points to make to owners. One, your dog or cat often doesn't care if they only have one eye. So it's a cosmetic thing. A lot of people are like about taking out an eye, but if you're doing it, it's because it's painful or it's popped out of the socket or they're not visual, and your pet is in more pain because of that, in my opinion. Enucleation is definitely warranted. But we did have Axio ask, when do we perform an enucleation? If it's not obvious, I really struggle with like when to pull the trigger on that. So do you have any kind of hard and fast rules on when you do an enucleation, or is it related to the pain of the patient? Is it finance related? Where do you lay with all that?
I think a lot of it does depend on the client and what they're willing to do. So if we have a perforation that is that they don't want to do any type of surgery right now, then I would at least allow that eye about a week's time to see if it's going to either reseal or if it's going to start to heal, or both. If it is not getting better after about a week, that eye probably needs to be removed if we're not going to do a graft of some kind. If we have a blind, painful eye that is not going to get better, like a glaucoma eye that's not responding to anything, or we have a big rupture in a glaucoma eye that's blind, then eye removal also is warranted there. Because I totally agree that your animal doesn't really care if that eye is there, especially once they lose vision. Because my phrasing is, or kind of what I say is, the only way your animal knows that eye exists right now is if it hurts. So the only thing eye removal is going to do for them is remove that pain. They're already used to not being able to see out of that eye, so it's not going to be a big shift for them. It is a lot of anthropomorphizing on our end.
No, but I do think that's something that's important that people need sometimes. And I also tell people dogs are highly adaptable. So even pets that because if they got glaucoma in one eye, they certainly could get it in the other. So I've seen pets, have both eyes gone, or just go blind because of sudden retinal detachment or something. And they do really well. As long as they're in their home and the place that they're used to, they have so many other senses that they still get around really well. And there's some dogs you wouldn't even know they were blind or didn't have eyes, based on how they act. So I do think that's a good point for pet owners to know is enucleation is definitely not the end of the world for your pet. And we're only going to recommend it if we really, really believe that is the next best step for them. So,
yep.
Speaking of sight, so I had a couple pet owners ask about cataracts. And so Archie Palm wanted to know, is there any cataract-dissolving eye drops? And I have seen supplements and things out there that claim that they might help with cataracts. So let's just go to the expert. What are your thoughts on that?
There are no drops that dissolve cataracts, because if there were, humans would be on them, and cataract surgery would not be one of the top ophthalmic surgery done for humans. So the answer is no. There are some ophthalmologists that think that there are some supplements that can maybe slow the progression of cataracts. But I would probably say the research behind that is minimal and kind of limited to maybe a paper, maybe one paper that indicates something like that. So in the end, cataracts usually do whatever they want. So some progress, some don't. It all depends on the cataract. And the only way to really get rid of them once the animal is affected by them is to surgically remove them.
Yeah. And that surgery is fairly routine. They do pretty well with that.
They can.
In my experience, what is your thoughts on that?
So kind of the percentages that I quote when I am talking about cataract surgery is that 85 to 95% of these patients are still visual a year later, and 80% of them are still visual 2 years later. So it definitely has a higher complication rate than humans for sure. But that's because dog eyes especially do not tolerate that. They're a lot more sensitive. So they have a ton more inflammation after surgery, which can lead to complications like glaucoma, which can, of course, take their vision away. So that is one reason why I will recommend surgery on patients who are already blind, basically, from their cataracts, because if the worst case scenario happens and they lose their vision from a complication, they at least kind of go back to their status quo, versus taking an eye that's minimally affected and that dog is visual. I don't want to blind that patient with a potential complication.
Okay.
Yeah.
I think that's fair.
Mm-hmm.
I'm shocked how many owners are actually willing to go do cataract surgery on their pets. Not to say it's not worth it, but I don't think it's something that people know is an option a lot of times. And then when you say well, they're like, what? And in my area, it's actually not as expensive as a lot of people thought it was going to be. Not that it's cheap,
Right.
But it does seem like something that is attainable. But it's not a, $10,000 orthopedic surgery in our area.
Good. I was going to say
So
in your area, it's not $10,000.
yeah, in Texas, in our area. But I do think it's worth having the conversation, right? And being aware that it is an option, because a lot of pet owners don't know about the extent of care we can do for pet patients. And so it's our job to educate them and to offer them really everything that's available for them. So I like talking about those things because I always get comments like, you could do cataract surgery on dogs? What?
Yeah.
And your account on Instagram is great too, because you show a lot of different procedures that can be done at a high level, which is really, really important. So, okay, we only have a couple more questions. Are you doing okay?
Let's do it.
Okay. You're doing great. I'm loving this. So at Rebecca Joy Music wanted to know, why are humans and dogs prescribed the same medications in ophthalmology?
Oh, I've never gotten that question before, but I would say probably multifactorial. In general, the eyes between dogs and humans and cats and humans are relatively similar as far as the different receptors that they have, like how they respond to medications. And of course, human eyes are prioritized over animal eyes. And so most of our drug research is all done in, well, I guess I would say in like lab settings and rabbits and whatnot, and then kind of progresses on into humans. And it's cheaper for the veterinary medicine probably to use these products that are already generic options for humans than to have veterinary specific medications, because that's where the cost really goes up.
Yeah, I think that is a big point, is just the research that goes into animal specific medications versus human is very different.
Mm-hmm.
And I'm glad there's so many things available to us. The cost of some of these drops when you're getting into higher level treatments can be pretty significant. But I do have people use like GoodRx and different options to try to find like the most reasonable thing that they can. But we also struggle with how expensive these things can be, and how available they are depending on what's going on in the human world.
Yep.
But I am glad that there's so many options for us, if we really can look around and do the work, I guess, in general. So, okay. So just two more questions. At Nitmo wanted to know, what happens when a dog damages their nictitating membrane, like from a cat claw? And I had a couple of questions about that. So explain what the nictitating membrane is. And I would say like a cat claw or injury from another pet is one of the more common things I see. But what happens with that?
So the nictitating membrane is also called the third eyelid. And humans have one too. It's just that vestigial little pink dot in the corner of your eye. But that's basically a protective mechanism for the eye. It comes up passively when the eye is kind of sucked back into the eye socket from pain or reaction of some kind, or when they're asleep. You may see that third eyelid pop up. That's not an issue, so don't be worried about that. But it also helps distribute the tear film, and it helps to clear debris from the eye. There's also immune tissue in that third eyelid that kind of helps support the local immunity for the eye, or the local immune system for the eye. So when it's damaged, ideally, it also houses a major gland for tear production as well. So when that third eyelid is damaged, it depends on the degree of damage. So a small little tear in the kind of leading edge of that third eyelid, I pretty much just trim that excess tissue off and just leave it alone after that. If it is a full thickness, like large laceration, then I do think that those should be surgically repaired. There is a sheet of cartilage that's in the third eyelid, and that cartilage, if it is exposed, can actually rub on the cornea and create ulcers and discomfort. So we want to make sure that cartilage is not exposed. It's a very thin little sheet, so you kind of have to palpate for it, and sometimes you can see it because it's like a little pinky white tissue that's there. But if that's exposed, then I think it needs to be fixed, kind of whether or not it's a huge thing or not. And that conjunctival tissue heals quickly. So.
Well, and that's when you have to get out like the 6/0
That's
suture,
right.
like
6/0.
Y'all, the suture used in ophthalmology, like I feel so old when I use it, because it's literally it's like a piece of hair is what it feels like when you're doing like a third eyelid, like a prolapse, or you're doing something. And I'm surprised we didn't get questions about a third eyelid like prolapse or a cherry eye.
Mm-hmm.
So I have one question about that. This is from at Dr. Tanaja Crocker. I would love to know, what is the true success rate on prolapsed cherry eyes in bulldogs and patients that are like that? Because my experience has been it is lower, and I've heard that from ophthalmologists also. So little client education on expectations with that would be awesome.
Great. Yes. So bulldogs do have bulldogs and similar breeds. So I would say bulldogs, and then you have your giant, like mastiffs, Great Danes, those types, Cane Corsos. Those breeds can all have a lower success rate. In our literature, we say up to a 30% failure rate in those dogs. That's, I think, particularly using a Morgan pocket technique to do that surgery. With those dogs, I kind of give owners the option of doing a Morgan pocket by me as an ophthalmologist who does it a lot versus someone who doesn't do it as often. And then I still kind of say maybe up to a 30% complication rate with a Morgan pocket, but how many have I had, knock on wood, I hope I don't jinx myself, how many have I had come out from that's a bulldog or something is, I don't actually know because I don't remember any.
Woo,
you know,
look at
knock
that.
on wood, knock on wood.
I love it. No, I think that's a great point, because I tell people, like, you know, I do this surgery fairly routinely, not as much as an ophthalmologist would, but certain breeds, I'm like, you really should go to the ophthalmologist.
Kind of one of the reasons to come to me and maybe pay a little bit more is hopefully you're doing it once. Even though it's more expensive, you're doing it one time. So hopefully overall it's less expensive. If I'm really concerned about a success rate with a Morgan pocket technique, then that's actually where I do a different technique that's newer, like 2012, 2013 is when the paper came out, where it's actually a ventral rectus tack. And that's where you actually suture the gland to your ventral rectus muscle that sits under the eye. So that's a little bit more invasive, but that paper had over 100 dogs, or had 800 dogs in it, and it didn't have any recurrence rates with that surgery. So I will opt for that in those more problematic breeds, depending on what the owner kind of opts to do. Because it's definitely faster to do a Morgan pocket.
I mean, being older in this, I would just tell like GP vets, like, set yourself up for success and just refer those breeds for the cherry eye.
Because they even stink for me to do. You know?
Yeah, like, it's just one of those things. I don't care how confident you are in it. Like 30% is a very high surgical failure rate, and that is with, you know, people that do it a fair amount. So even when you set client expectations, it still is a surprise when it doesn't work, you know, to people. So just refer them. That's my 2 cents. Like, just refer those cherry eyes to y'all and let you handle it.
And can I say one thing about that too?
Yeah, you can say whatever.
Just for I guess for primary vets and then for our owners too, if a gland pops back out within the first week or so, then it is probably a suture problem that has ruptured, like more of a technique or something as well that maybe has failed. If it has popped out beyond that, like say 2-week period where everything should be healed, then we're probably dealing with the dog's factors being the issue. So especially a Morgan pocket technique, you're creating just a line of scar where that gland can't come up. But if you have a bulldog or a Cane Corso, they have so much extra conjunctival tissue that in my mind, it just goes whoop and goes around that scarred area. So that may be more of a dog factor if it's beyond 2 weeks versus a technical factor if it's before that.
I like that. I mean, I'll accept that feedback, and maybe I've had some early, maybe I've had some late. So we just won't go there.
Well, that's also like, did they rub? You know, are they turned out to go fetch a toy the next day? You know, because these sutures are very small. That tissue is very thin. It is very easy for it to pop. One of those things to break, and then the gland comes right back out. So I don't mean for it to be like a doctor factor, but just like anyway, technical factor.
It's fine. It's called practicing because none of us are perfect. And so I just have to embrace that. So, okay. Final question. I think this is a good one to end on. At Disabled DVM wanted to know, what is your best resource or book for doctors to have on hand when they're dealing with eye stuff? So she's an emergency intern right now. But in general, do you have like a go-to book that you think is best resource, maybe dumbs it down a little bit for
Yeah.
us, is good to search, what would it be?
There is a pared down version of our ophthalmology Bible, which is called Gillette, Veterinary Ophthalmology. And Gillette has created an Essentials of Veterinary Ophthalmology that is a paperback pared down version of this huge 2-volume set. And it kind of includes, maybe if you're interested in eyes, but aren't going into full veterinary ophthalmology, it's kind of a good resource just to give you a little bit more detail than you're probably used to, but not like the full-fledged explanations of everything. But it's called Essentials of Veterinary Ophthalmology. There's also an author, Slatter's. I think it's if you Google like Slatter, Slatter''S, and then there's Veterinary Ophthalmology, and there's a surgery book as well that has great pictures in there. Those are kind of the two main ones, I would say. As far as like an emergency text that you can look at, there probably isn't like a published one that I know of. Granted, I don't have, in my training and stuff, we didn't really have that available to us because we had to know all the complicated stuff. So I could definitely be missing something that's out there. I just haven't had to go look for it. So
no, those are good resources. And I would also say a good resource is having a relationship with an ophthalmologist.
Totally.
I definitely have ones that I can send pictures to. One of the local referral clinics has a great text message thread. You can send them case information, pictures. They'll say like, okay, put them on these things. Yes, we need to see them next week. Or, like they give really good information, almost like a consultation. But I think forming relationships with specialists who are more practiced in these areas, is really helpful as a general practitioner and as an ER doctor. So that is it. You survived. How do you feel about it?
Oh, we can keep going.
It was great. And I do think if people want more great information and pictures and videos, your social media account is wonderful. And you do a really good job of explaining things and giving us the visual, which I think is important with this type of subject. So definitely follow him on social media. And then if you guys have any questions for us about follow-up, you can reach out on social media accounts at Questions with Crocker, at the Vet Eye Guy. I'm also on Facebook, which is old. You're probably not, but that's okay. And you can watch us on YouTube if you want to see us laugh and do air quotes. So
there you go.
We appreciate any reviews. Do you have any final words of advice? Do you have any final things, pearls of wisdom you want to leave us with?
I would say for your general practitioners, practice when it comes to ophthalmic exams, because that's the only way you're going to feel more comfortable about identifying abnormal versus normal. So practice. Even if they don't need a funding exam, do it. So you can start to solidify what is normal in your brain. And then for owners, just follow instructions.
I mean, that is the best advice we can give anyone. That's wonderful. All right. Well, thank you so much for being with me today, Dr. Sigmund.
Thank you.
And thank you guys for listening, and have a great day.